All right, it is 7 o'clock, so we're going to go ahead and get started. Welcome, everyone, to tonight's presentation. My name is John Mantia. I'm the co-founder and director of finance here at Parco. I'm joined also tonight by my colleague Quinn Ackerman, who some of you may have seen before or I've heard before, who presented past webinars. She always helps build all of our presentations, and we're very happy to have her on the line tonight. She'll be helping answer and moderate any questions that you have within the Q&A section of the Zoom call. So for those of you who are new, welcome. For those of you who have been and been to our presentations before, welcome back. We are Parco. Parco stands for Pensioned Americans Retirement Company, and we do retirement and financial planning for anybody with a pension, in particular, federal employees. We spend most of our days as a team speaking with clients, helping them through their situations and figuring out what their retirement plans are wherever they may be. For some people, it's they're just starting out their careers and wanting to make sure that they've done all the right things at the beginning to make sure they're in the right place for the future. For some people, it's in the middle of their careers, wanting to make sure that they're basically doing a pulse check to make sure they're on the right track. And then oftentimes we're speaking with people who are nearing the end of their careers or already retired, wanting to make sure that they're ready for the next step in their life. Whenever that may be, we help all of our clients and we help people of all ages figure out their retirement planning. You may have seen us or read us in a couple different publications. We've been featured in more and more places, places like Wall Street Journal, Forbes, U.S. News and World Reports. People are hearing more about what we have to say because of these webinars. So tonight we're speaking about sick leave. We did a presentation on this last week. Tonight's the encore presentation. It's always a very popular topic. And tonight we're specifically going to go into a couple things that are unique about sick leave as one of the benefits that you have as a federal employee. We'll talk about what sick leave is, so defining it. Then we'll talk about sick leave and retirement, so how sick leave interacts with and is factored into your retirement. Then we'll walk through an example of what we call your ideal number of sick leave. So let's go ahead and get started. So first, let's define what sick leave is. So sick leave is a benefit that you have. It's distinct from annual leave and is leave that's meant to be used for specific, what we describe as medical needs. So this could be personal medical needs, like you need to go visit your doctor or you're feeling ill and you can't go into work. It could be used for family care and bereavement leave. It could be used for family care for health conditions. So for FMLA, we know for Family Medical Leave Act leave, we know many clients who looked at or who needed to take FMLA, especially during the pandemic that we had last year and into this year. And then also you can use your sick leave for adoption related purposes. So some of the powerful things about sick leave as a benefit is that there's no limit on how much sick leave you can accumulate over the course of your career. With annual leave, the other form of leave that you have, there's an annual rollover limit, and then there's a maximum amount that the government will buy back upon the time that you retire. With sick leave, that's not the case. There's no limit on how much you can accumulate. So we've seen clients with 2, 3, even 4,000 hours of sick leave accumulated as they approach retirement. And then depending on the agency you work with, so that's one of the unique benefits. And then depending on the agency you work with, notably the United States Postal Service, your sick leave is advanced to you at the beginning of the year. So rather than earning new leave every pay period, you actually have that sick leave available to you right at the beginning of the year if you work for the United States Postal Service, and then you earn it or you accrue it over the course of the rest of the year. So some of the limitations around sick leave, and there's rules about how you can use it. So if you need to take time off for personal medical needs, there's no limit to how much sick leave you can use at a given time. So we've had clients take off months for surgeries they needed to do. I had a client that had one knee replaced and then had another knee replaced. She was out of work or she was using sick leave for 6 months. There's no limit on how much sick leave you can use for personal medical needs. If you need to use it for general family care and bereavement, you can take up to typically 13 work days or 104 hours of leave. And then for care for family members with a serious health condition. So this might be where you use your Family Medical Leave Act leave or your FMLA and use your sick leave for under that provision. You can take up to 60 working days or 480 hours of sick leave. So now let's talk about sick leave in retirement. We've talked a little bit about what sick leave is, but now let's talk about how sick leave interacts with your retirement. The first thing that you need to consider and need to understand about sick leave when it comes to retirement is how OPM calculates how much sick leave will be credited toward your time in service. And the first piece to understanding that is that roughly 174 sick leave hours equals 1 month of extra pension credit or 1 retirement month. So we often get the question of, should I use my sick leave or not use my sick leave as I approach retirement? And we think it's helpful to use an example like Federal Frank. He works for the United States Postal Service. He was hired on the first of the month. You'll see why that's important here in just a minute. He was hired on the first of the month. He knows to retire on the last day of the month. As for his employees, it's always best to retire on the last day of the month. And he has 174 sick leave hours. His gross salary is $61,980, and his high three is $60,000 for simplified example purposes. So the question is, should he use his sick leave if he can, or should he retire with it? Well, let's pretend he retires on July 31st. His retirement posts the 1st of August. We've gone through this before and how your retirement's calculated. And then he gets his first partial pension check that first week of September. So he effectively retires with 174 hours of sick leave, which is an extra month of pension service. It adds an extra month of service to Frank's time in service. So by retiring with that extra month of sick leave, his pension is $4.17 higher per month for the rest of his life. If instead he said, hey, I'm going to use my sick leave. I have some medical procedures I need to get done. I need to take some time off before I retire. I can do so. So he uses his sick leave for the entire month of August and his retirement, and he retires at the end of August instead of the end of July. So he retires at the end of August, so a month later, and his retirement posts the first week of September. Then he waits a month and he gets his first partial pension check that first week of October. So his pension's still an extra month higher because he used that sick leave and pushed out his months of service an extra month. But then also, since he was using that leave, he gets an extra $5,165, his monthly gross pay for not going to work. So this is typically just a simplified example of why we say to clients, if you have the opportunity to use your sick leave, it's almost always worth it to do so if you can. Like I just said, use it if you can. So now let's talk about your ideal number. I know we went through this a little fast last week when we went through this, so I'm going to try to go through this nice and slow. And we've made some changes as well based on the feedback we received last week to make this even more clear what we're doing here and what OPM does and what we talk about when we speak about your ideal amount of sick leave. So it hinges on this idea of a use or lose balance of sick leave, and that use or lose balance is dependent on the specific sick leave balance that you have, your specific service computation date, and your retirement date. So based on those 3 factors, we can determine some ideal amounts of sick leave to try to retire with. So let's use an example of somebody like DOD Dave. He was hired on June 5th, 1988. His planned retirement date is July 31st, 2020. So he's planning to retire at the end of the month of July. He has 350 sick leave hours, and he asks, hey, what's my use or lose balance? How much of this sick leave will I have credited toward my time in service? So for his employees, first, we know about DOD Dave that he's going to retire on the last day of the month. But for DOD Dave, he was hired on the 5th. So what that means, he was hired on the 5th. That means that every time the 4th of the month rolls around, so every time the 4th of the month rolls around, he completes a month of service for Dave, because your pension and your creditable time in service is calculated in months, not years. So every time the 4th of the month rolls around, that adds another month of service for Dave's pension. However, we know that Dave was hired on the 5th and he's retiring on the 31st. So thinking through what the implications of that are, if we work backwards, that means that those first 26 days where Dave was working, all else equal, wouldn't count toward his time in service because he didn't complete a month. He retired on the 31st. So what we need to do is we need to make it look like Dave was hired on the 1st. Because if we make it look like Dave was hired on the 1st, then he'll get credit for those 26 days because he was retiring on the last day of the month, the 31st. So the way we round off that first month of service for Dave is we use an OPM uses his sick leave. So what's the calculation that OPM does? Well, this is the actual calculation that OPM does. They'll take your retirement date and they'll subtract it from your hired or from your date of hire, from your service computation date. And so in Dave's case, that yields 32 years, 1 month, and 26 days. Now we know that he's going to get credit for those 32 years and that 1 month because your pension and all your service credit, you get credit for whole months of service. So when we convert that 32 years and 1 month and 26 days into months and days, that's 385 months and 26 days. So absent anything else, those 26 days that he worked would go to waste. Now we need to figure out, okay, how do we round off those 26 days? Well, OPM says that the formula to do so is you take the number 30, you subtract out those hanging days, so those 26 days, and that yields the number 4. Then there's a specific OPM sick leave conversion table that you refer to. And from there, we look at the number 4, and we say, okay, well, what does that mean? Important little caveat to note, the reason why you can't say there's exactly 174 sick leave hours in a retirement month is because there's 1 month where it's 173. But getting back to this 4 number we were talking about, so Dave needs 4 sick leave or needs 4 days to round off that first month of service. So referring to the OPM sick leave table, those 4 days. And if you look off to the right, that tells you how many hours converts to that 4 days. So you might look at that and say, okay, well, Johnny needs 23 hours of sick leave. Well, 23 hours would do it. But at Parco, we've gone deeper and we've looked at the OPM documents and we noticed in the table, well, there's a lot of numbers on here that aren't listed. What if you have 18 hours? What if you have 19 hours? What if you have 20 hours? And what it says is that if you have a number that's not listed on this table, you round up to the next nearest number. So what that means to us when we're doing this ideal sick leave number and we're trying to optimize for a given client situation, we say, well, look, Dave, you don't need 23. You actually need 17 plus 1 or 18 hours to round off that first month of service. So by doing so, if he rounds off that first month of service, he'll have 385 months and 30 days, which would add another month, which rounds off that first month to 386 months of service. Now, Dave still has sick leave remaining, and the way that OPM will add further service is by subtracting out 174 hours until they can't anymore. So let's walk through that mechanically. So first, we use 18 to round off that first month of service, which gives him 386 months of service. And he has 332 remaining hours. Then we subtract out 174 from that 332, adds another month of service to his time in service, leaving 300, again, this should say 387, and he has 158 sick leave hours remaining. 158 is less than 174, so that 158 hours would be effectively his use or lose balance. So 158 sick leave hours. Again, that's his use or lose balance. We divide that by 8 because there's 8 work hours in a day, which means that Dave would have 19 hours and some change or 19 days and some change of use or lose sick leave based on his numbers. And it's one of the things that we spend a lot of time at Parco helping our clients navigate and figure out is their ideal sick leave balance based on the date they were hired and the number of hours that they have or plan to have at retirement. Here's a copy of our works cited from tonight's presentation. We're always happy to share it. And then in terms of upcoming webinars that we have, we're going to be doing one next week covering postal particulars and how postal employees have different benefits from other federal employees and the differences between working at the post office versus other agencies. Further, we'll be talking about disability retirement down the line, Medicare and FEHB, something that we're having more and more people ask questions about. We'll be going through the retirement paperwork, simplifying that process to shed some light on how relatively straightforward that is. And then we'll talk about transitioning from a veteran to a civilian. 30% of the workforce for the federal government are veterans. So something else we want to highlight. So myself and Quinn are going to be staying here in the Zoom call, answering any questions. We're happy to run back through anything that wasn't necessarily clear or try to figure out your numbers within the webinar, or if you'd like, set up a time one-on-one to go through it. As always, it was wonderful to see everybody tonight, and we look forward to helping answer any of the questions that you have.